Hi, my name is Emily Lieberman, and today I'm going to be doing a research proposal on how effective vitamin patches are compared to vitamin capsules in controlling the replenishment of nutrients that are lost from alcohol consumption in young adults that are ages 21 through 25. So, just to start off with a quick introduction into why I want to do this research proposal and why this research proposal is something that is important. So, vitamin usage with alcohol withdrawal patients has been a very common practice in healthcare. The use of vitamin B1 supplementation is also known as thiamine, and this is used to prevent something called Wernicke's encephalopathy, and it aids in restoring the electrolyte imbalance that is lost from the consumption of alcohol. So, what Wernicke encephalopathy pretty much is, it's a disorder of the brain due to the lack of vitamin B1, also known as thiamine, or chronic alcoholism. Some long-term effects of this disorder includes mental confusion, inability to walk. Patients often see double vision, and also something called ataxia, which is no muscle control. So it definitely affects, the nerves, the brain, the vision is impacted, and patients are not able to have that muscle control as well. Treatment in the hospital usually occurs immediately with thiamine 100 milligram IV solution, and this is done from 3 to 5 days. So we can see that the alcohol definitely causes that lack of micronutrients. It causes the thiamine deficiency, and if this is not treated right away, will develop into the Wernicke encephalopathy. And as I already mentioned, these can have detrimental long-term effects if not treated properly. So this comes back to my research question and why I want to focus on young adults ages 21 through 25 who overconsume that alcohol. And my main purpose is to see how effective the vitamin patches can be compared to vitamin capsules to help control and replenish those nutrients that are lost from alcohol consumption previously to having to be admitted to the hospital and trying to help stop this issue from occurring right away so patients don't have to immediately go to the hospital and get that IV fluid solution. So, some common vitamin patches that are on the market include something called Vitamin Patch Club. We have brands called Patchade, Booze Bandage, and the Good Patch. And some capsules that are available on the market include NutriCost, bulk supplements, Nature Made, and Vitamatic. So there are a good amount of the patches and a good amount of the capsules that are available in store and online for consumers to purchase. So definitely want to just look into the brands overall and see, the differences between the two. Looking further into the literature review, I found that problems with the transdermal patches have been noted that include the challenges of the patch to pass through the physical barrier of the skin and not being enough evidence for the effectiveness due to the lack of studies with these patches. So the patches are fairly new to the market. And again, the patch, the biggest problem that I found through the research, it's not able to go through the skin barrier since it is pretty much just a patch that goes into the arm and it's not able to break through the skin barrier as well as an IV may be able to do. Research has also shown that the delivery of thiamine orally shows slow results with replenishing depleted brain stores when compared to perinatal administration. So there are also some discrepancies with how effective the capsules are as well. And then another thing I found about the patches is that it does show advantages in terms of avoiding side effects on the GI tract, continuous drug delivery, and the easy methods of application and removal. So, overall, with the literature review, this is still fairly a new concept and a new study that is going on. But based on what I did find, is that there are pros and cons to both the patches and the oral supplements. The big question is what other research can be done to see how effective one may be over the other. So that goes into my design study. So to do this study, participants will be assigned either Group A for the vitamin patches or Group B for the vitamin capsules. So again, capsules include a brand Nature Made with 100 milligrams. This is pretty cheap on Amazon compared to the patches. example, Vitamin Patch Club, it would be 30 patches you could get on Amazon for around $42. So there is a difference in price, but again, there's so many different brands and options available on the budget that a participant may be able to use in the study. The study will take place in New York City and will be conducted on a weekly basis for 1 year. So I am currently residing in New Jersey, so New York City is pretty close to me. There's a lot of colleges in New York City that include NYU, Columbia, Fordham University, etc. So a lot of opportunities for participants. There's also, according to New York City Gov, 2,100 establishments in New York City that sell alcoholic beverages. So that gives more of an opportunity to gather participants in this specific age group that I'm looking for. So participants will report back weekly to the researcher, answering questions given to them on a survey. So with the survey, some questions that may be asked include the health status of the participants, how many drinks they were having for each week, any side effects they're going through, and also getting their 24-hour recall in order to get a good idea of what they're eating throughout the day. So that could be a good comparison with the vitamin supplementation to see how their nutrition is. So their questions can also include their exercise status, how much water they're drinking, etc. Also, blood work will be done halfway through the study and it will end of the study. So with blood work, a good vitamin test could be the LabCorp vitamin deficiency test. Again, LabCorp, there's a lot of locations throughout the tri-state area, so it is pretty easy for participants to go get blood work done. Again, participants will get the consent, so they don't have to do the blood work if they don't want to, but the blood work will help with getting more accurate results and see how the vitamin levels are doing as well. Some exclusion factors for the study include the ages. So we are not accepting anyone that is below the age of 21 and anyone over the age of 25. The main priority is to make sure that these participants are of the legal drinking age. We don't want to have any participants that are under the legal drinking age. And I believe the age of 21 through 25 is the most common with alcohol consumption and just going out to places like nightclubs, bars. So I think this age group will definitely show good results. So we definitely want to focus on more of these 20s group as well. So other exclusion factors include history of health conditions that may alter the study. So some health conditions also include psychological and emotional conditions. Participants prior to study will be able to inform the researcher about these. This will just help with making the results as accurate as possible. And of course, we don't want the vitamin capsules or the patches to affect any health conditions that a participant may have. And of course, pregnancy or the intention to become pregnant during the study. We don't want anyone who is pregnant or trying to get pregnant to be consuming alcohol. So those are just some exclusion factors that we're going to be looking for. Anticipated results with the study. So it is expected that the vitamin capsules will most likely show better improvement in replenishing the lost micronutrients compared to the vitamin patches. So some reasons I may believe this will be a better improvement in replenishing those lost micronutrients includes the ability to go through the skin barrier for the patches, that these are a newer product on the market, some side effects that may result with the patch use, and also the cost. I think the cost is a big thing that I found that may have the results altered due to, participants may feel like they don't want to be spending, $25 just for 5 patches or 25 patches being $125. So they may be like, I don't want to use these vitamin supplementations anymore. So the pill capsules might just show better results due to participants being able to afford it more. And also just it's probably easier to swallow a pill than have the patch on. But again, the results may vary. So that's why this study could be very important and could show altered results as well. Ethical considerations that I want to consider in this study is obviously the safety of the participants, making sure that, their names are anonymous, that they get the informed consent, their privacy, everything will be laid out for them in a contract. They'll go through HIPAA agreements and they'll have the copy of what is going on in the study, their role in study as well as the researcher. So everybody's just on the same page. Some challenges that I considered in the study includes the timing. So this is a 1 year study, and again, this is something that does require some work from the participants. So timing may be an issue with some of the participants, especially in this age group. I know it can get challenging with classes, work, just life in general. So yeah, timing is definitely going to be something to consider. And then the dropout rate. I think that's with any study, there's always a chance that the participants may drop out. They may feel like the study is not for them anymore. So that's also something that I definitely want to consider in the study as well. And that's pretty much my presentation on my research proposal. Thank you for joining me today.